my name is Suzanne Gornell. I'm a clinical trials nurse at Memorial Sloan Kettering. I have been here for the past 19 years and specialize in renal cell carcinoma. Today I'm going to talk about some of the common pulmonary side effects that we see with checkpoint inhibitors and immunotherapy and how they're managed. Immunotherapy can cause inflammation of any of the organs. These drugs may increase your immune response, resulting in a severe or possible permanent condition. Pulmonary toxicities are typically nonspecific and difficult to assess. It's hard to distinguish between toxicity and disease-related complaints because the most common area for kidney cancer to spread is the lungs, or whether a patient has an infection or anemia. So if you call with respiratory complaints, we typically do need to bring you in for an assessment. The incidence of pulmonary toxicity isn't very high. It's only about 2 to 4%. Men and former and current smokers are at the higher risk. The onset is typically 2 to 3 months after initiating therapy, but really can occur at any point. Diagnosing pneumonitis is something that we need to assess closely. CT scans is the preferred diagnostic study. The doctors often see it, they call it a reverse halo. It's just looks like a ground glass opacity surrounded by tissue. So that's how they're able to diagnose pneumonitis by a CAT scan. They will often also do a pulmonary function test and possibly a bronchoscopy. And bronchoscopies can diagnose whether it's the cancer versus an inflammatory process versus an infection. So these are typically done by a pulmonologist. That's if patients have pulmonary issues such as a persisting cough, even when they're starting therapy, we often start by sending them to a pulmonologist so we're able to closely assess how they're doing. Sometimes the radiologist will see a ground glass opacity. That's what they mention in the scan report, or what they will sometimes say is pneumonitis. But you may be asymptomatic. You may be feeling fine, your oxygenation is fine, you don't have a cough, you're not short of breath, but we will continue to monitor you closely. And therefore, if you called and said you had any of these symptoms and we looked back at your scan and saw this, we'd be more concerned. If suspected, though, clinically apparent pulmonary toxicities, the initial therapy or treatment would be to hold your immunotherapy and initiate a corticosteroid because this can be a serious side effect. The pulmonologists usually prefer, at least at Memorial, a slow taper of the steroids versus the faster taper that we do with other toxicities. Therefore, you may see yourself on steroids orally for months instead of weeks, but it all depends on the physician, the pulmonologist, and the status of your cancer. If the steroids do not work, patients may be started on an additional immunosuppressive agent. An example of one is infliximab. We at Memorial typically discontinue patients with pulmonary toxicity, but patients that have this toxicity may have long-term benefits of the immunotherapy without any more treatment. Patients can have only a few treatments with the immunotherapy, and we continue to see them have a decrease in their disease. Like many other immunotherapy side effects, lung toxicities may be difficult to diagnose and assess, as I mentioned. Please make sure that if you're experiencing any shortness of breath, a new cough, an increased cough, if you notice your cough is keeping you awake at night, or if you notice that you used to be able to walk a mile without resting and you're only doing a couple of blocks, or you used to be able to go up in the steps in your apartment and you had no issues, and then all of a sudden you can only go up half a flight or one flight. These are things we need to know. These are the types of side effects that may progress quickly, and the earlier we intervene, the better. Please report to your nurse or physician if you're having any side effects that I mentioned here. And any further questions, please call your medical team. I hope this was of assistance. Thank you.